Hello, my name is Oscar Giovanni Villeda. I'm a student physical therapist assistant at IOT, Institute of Technology, with Cohort 4. Um, I'm Salvadorian, I'm 28 years old. I live in Modesto, California. I've lived in Modesto my entire life almost, with the exception of the 5 years that I went to Humboldt State University to get my bachelor's in kinesiology, exercise science, and health promotion. I graduated in 2019. Um, I've worked as a personal trainer, group fitness instructor. Um, I've worked in some PT clinics. And yeah, some of the things that I enjoy doing is working out. I love fitness. I like staying active, moving my body, and yeah, that's something that I've enjoyed a lot. Um, Something I grew up playing was soccer. I grew up playing soccer for, I don't know, like maybe 14 years or so. I recently started doing, well, not recently, I started doing CrossFit about 2.5 years ago, almost 3 years ago. So I've been doing CrossFit for a while. I really enjoy CrossFit because it's a lot of functional movements that we do in there. I've been working at a chronic pain clinic for the past 3 years, alongside with different other physical therapists. So that kind of is what really pushed me, not really pushed me, but kind of opened my eyes to PTA, because they talked to me a lot about it and the benefits of it as well. And, they see that I'm really good at working with our chronic pain patients. So they advised me to do it. Several of them advised me to do it. But what really kind of pushed me towards the health field in general was when I was 13. I tore my meniscus on my left knee and I had to get surgery. So that was successful, thankfully. But that put me into PT right after my surgery. And at that point in my life, soccer was my entire life. So the fact that I couldn't play for so long kind of put me in a very depressive mood. Wasn't myself, and very lethargic, very just not wanting to do anything. So I'm actually very thankful that I went into PT, because the PTA there really got me out of that hole. I know, like, I remember just it felt like being like a hassle trying to get there because I couldn't really move or walk. But when I was there, the PTA there, he made me really feel, I don't know, seen. He made me feel cared for, acknowledged, and he made everything else feel okay. And that's the feeling that I got from that PTA is what I want to be able to give out into my patients, right? Because I know, like, no one likes being injured. It sucks, right? Because I've been injured multiple times, not just my left knee. I've had my Achilles ruptured. I've had pulled hamstrings, pulled quads. Um, yeah, my mom always says that I should be wrapped around in bubble wrap. But yeah, so that's kind of what really pushed me towards the health field, and that's why I pursued my kinesiology degree. And then also just personal reasons, right? I wanted to learn about my body and why I was built the way I was built. I was always a bigger kid, so just learning like the pros of or the benefits of nutrition, stuff like that too. So all of that kind of was where my interest was. I wanted to learn more about the body and how it functions, so I can also give that to the people I cared about, like my parents, for example. My mom suffers from high blood pressure and diabetes, so I was able to give her a lot of nutrition advice alongside with her doctor, and we're able to help her kind of control it. So that's kind of why I got into the field as well, and why I want to be a physical therapist assistant. I just want to help people, right? I want to help them get back to their functioning norm, and help them feel what I felt in my PT visits. Um, some of my strengths, I would say, is that I'm a hard worker, right? Once I set my mind onto something, I really get it done at any means. And yeah, I work really hard. I'm very determined. Um, I try to be a problem solver even at my job. So that also reflects onto my studies as well. Whenever I run into situations, I try to, think about the best route, best outcome. Um, my biggest weakness, I think, would be my overthinking. Um, I overthink a lot, and over the years, it's gotten better. But in general, I tend to overthink my decisions and stuff like that, or what's the best way to do things, or what I could have done better, stuff like that. So I'm really hoping with like these classes, especially this one, I'll be able to kind of eliminate that in a sense. Not necessarily take away my overthinking because I always want to get better, um, but help me be more confident with my patients, um, and just help myself be the best version of myself for the people around me, right? So I took the strength assessment quiz. I think it was strength assessment, the one that you posted to take, and I got self as the biggest score as 4.14, which makes sense because I like my alone time. I like my solitude. I like to be by myself so I can process all my thoughts and my emotions and stuff like that too. I feel like I can gather myself more appropriately, better, when I'm alone. So that kind of made sense, which was kind of mind blowing in my opinion. The next one is body movement, that I got, which was a 3.29, which also makes sense because I'm always moving, or I'm doing some kind of movement, some kind of exercise. And when I don't get my exercise in, or any kind of movement, it can be like a walk or something like that. But when I don't get it, I can feel the difference. Like mentally, physically, I feel lethargic, lazy, unmotivated. So that also made sense, which is another mind-blowing moment when I saw the results. And then the last one that I got was social, 3.14, because despite the fact that I do really enjoy my solitude, I like being around people as well, right? Especially people who have like similar goals, similar mindsets, right? I like to engage in in challenging conversations. Like I like them to be thoughtful. I don't like the small talk. I don't enjoy that at all. Um, so the more, how do I say this? The more I feel the topic is appropriate, I guess. Yeah, I guess I would say appropriate. The more I would want to engage, and like being in the cohort, I really enjoy being there because I know everyone around me has similar goals, right? And we all come from different walks of life, but we all engage in really good conversation, and it's not really small talk. It's like really real meaningful talk. There you go. That's what I was looking for. So I got a 3.14 on the social aspect, um, which is kind of funny to me because the self was first, and that really talked about like solitude and stuff like that. But yeah, I'm really excited about this semester just because it's going to be more hands-on. Yes, I know it's going to be a lot harder than first semester, but that's okay because that's what I signed up for, and I want to be the best me that I can be, because when I am my best me, I can give out my best effort, right? So I'm really excited to be a part of this class, be a part of this cohort, and yeah, looking forward to the semester and looking forward to being in your classes. Mr. Myers as well, Dr. Matz. Really looking forward to it all, right? Especially because I know this semester is going to be a lot of work, a lot of hands-on stuff, a lot of learning new material. I do work at a clinic right now, but it's different. It's not like the typical outpatient setting where like aides or with the patients doing certain exercises, stuff like that. It's very different. Um, so whenever other peers are talking about that, I really get intrigued because it's a different setting. Um, but yeah, so super excited, and yeah, hope you have a good day, and I'll see you. I'll see you tomorrow because it's June 5th right now. It's 7:38. So I'll see you tomorrow. Have a good day.